Now, we'll actually talk about another very important laboratory focus. So this is what is known as the alpha-1 antitrypsin concentration. Alpha-1 antitrypsin concentration. So for the alpha-1 antitrypsin concentration, you say that the concentration in the blood is like you're trying to look at the normal ranges and when it gets low. Okay. So the normal range in the blood is usually what 90 to 200 milligrams per deciliter. So any levels below that, that's where you are saying you have alpha-1 antitrypsin deficiency. Okay. So it's a genetic disorder. It increases the risk of you having lung diseases and also liver disease. So it's a protein that is usually produced by the liver, okay, and that protein will protect the tissues of the liver, okay. Protect tissues of the lungs. It's produced from the liver but comes to protect the lungs. Do you understand? So it acts as a protease inhibitor, preventing excess tissue breakdown, okay, during inflammation. So normal concentrations when you're having 90 to 200. Do you understand? So anything that is below this, you have alpha-1 antitrypsin deficiency. So once it is low, so just as a deficiency, and because it protects breakdown of tissues in the lungs, you now start having issues that will make you suffer from not breathing well. Okay, liver disease. Okay, it's associated with liver disease, neonatal hepatitis, cirrhosis, hepatocellular carcinoma, then paniculitis. So when it's elevated, probably is an acute phase. Maybe there's inflammation, infection, or malignancy. Okay, so the elevation is not typically an issue. Most of the times is when it is reduced that I say it's an issue. So if you want to test for the alpha-1 antitrypsin, you do blood test, okay, genetic test, all right, phenotyping, then you also back it up with some liver functions, okay, just to see that the liver function is actually, being maintained. So most of the times it's associated with the low levels, so it's associated with smokers. So stop smoking and stop being exposed to environmental pollutants.